Dear friends, today 12th April 2025, we have completed 1555 cases of Puberphonia today. We are getting more idea and more new cases. So we are able to formulate some more treatment procedure for Puberphonia. I want to explain all the things today, this Saturday, so it is a good idea. My feeling also goes, why not I try some online treatment for Puberphonia, because all over the world there is a great feeling. Puberphonia voice can be treated with a manipulation of the voice itself online. So I just want to try. I am We have tried in the corona time, and our online procedure, all the things were failure. But now we got some new idea what more we can do for Puberphonia. So this may give some inspiration for the boys who are hearing my speech. Now we are very much confident about the treatment of Puberphonia by Umar, Euler manipulation and resonance. Why we got so much confidence means we are able to get good result, not only good result, now we are able to create a good awareness, because Euler manipulation can change the frequency. Yes, active Euler can influence voice frequency. A lifted soft palate can create a larger and more resonance space in the vocal tract, leading to a richer and more pleasing tone, and potentially make it easier to assess higher note. So this we have found out. A pleasing tone you will get at the eula when you talk. A sweet spot we have found out in the eula. Contrary to an inactive eula or low active eula can contribute to nasality and limit vocal resonance. So Umar for Puberphonia, by lifting the soft palate with eula movement, can alter the frequency and quality of the sound, particularly in Puberphonia speech training, making the sound stronger and more resonant. Yes, lifting the soft palate can impact the fundamental frequency and harmonic frequency. That is more on the resonance mechanism. There is a fundamental frequency which is created by the vocal cord, but harmonic frequency is depends upon the vibration or resonance. It can improve the clarity and projection in treating Puberphonia. A lowered soft palate can lead to nasal sound because some air escapes through the nose. So lifting the soft palate helps to eliminate nasality, create more focused oral vocal sound. So change in the format of the frequency. Format frequency is change depends upon the resonance. You can adjust the shape and position of the vocal tract by altering the uvular movement, mouth opening, tongue position, and lip rounding. So this will affect the resonance with in your vocal tract, which is more influence the frequency of the formats. Try to understand. So the formats also having certain frequency changes which is initiated and created by the resonance. Specific raising of the palate with the uvula create more space in the vocal tract, potentially increasing the frequency. It can result in a brighter, louder, and more resonance voice. It is clearly already found out that change is first format is by adjusting the mouth opening. First format resonant change is by mouth opening. Second format F2 by moving the tongue body. Lip reading, rounding your lip generally lower the format frequency. So this is well proved. So why not we this universe use this and change the pitch. So our new finding is that uvula and the surrounding velum play a role in the shaping of the vocal tract, which directly affect the resonance of the voice, consequently the formats. So we have to do uvula manipulation. Formats of the resonance frequency produced by the vocal tract. They are crucial for distinguish between different vocal sound. The shape of the vocal tract, including the position of the velum and uvula, determine the size and shape of the oral and nasal cavity, which in turn affect the formats. Lifting the uvula, adjusting the velum can alter the cross-section area of the nasal and oral cavities, changing the way sound resonate with the vocal tracts. This change resonance will affect the formats. While the uvula does not directly control the pitch the same way as the vocal folds, change in formats, especially those related to the first and second formats, can lead to perceived shift of the pitch. A notable example is seen in throat singing. Manipulation of the uvula surrounding area of the upper pharynx allow the singers to focus specific harmony, creating a focused format which contribute to the melody of the perceived pitch. This is what we are doing in Puberphonia. So with this, we thought, why not we do some online consultation for Puberphonia boys and give them training. If it is successful, it is a great boon for them. But we have to find out the sweet spot where the feeling of the air movement in the pharynx is felt at the level of uvula. So we have formulated few exercise. Thereby the pharyngeal voice is produced. A resonating frequency change is happening in the pharyngeal region. So, number one exercise is flex the neck forward. Flex the neck slightly forward and focus on vibrating the uvula and get a great resonance in the nose. How to practice it? Slightly tuck the skin, tuck the chin, and humming like singing. You have to do it while focusing the vibration on the uvula and subpalate and resonance in the nose. So now you are keeping the uvula and subpalate vibration and active. So a great nasopharyngeal resonance, we get it. That is the flex the neck forward and talk in Puberphonia. I personally feel it is easy to understand. This is our olden days teaching for students, medical student, how we will do indirect laryngoscope examination. For that, you have to flex the neck, protrude the tongue, and introduce the indirect laryngoscope into the mouth, pharynx. You can see the vocal cord easily because the upper part of the oropharynx, the size will increase in all dimensions. When you flex the neck forward and make vibration in the uvula and nasal resonance. So this is the first exercise. Flex the neck forward, uvula vibration and nasal resonance. This is what we are doing while doing indirect laryngoscope examination with mirror. So if you want to see completely the pharynx and larynx, do this maneuver and see. Here we can find out the sweet spot in the uvula. Second technique is pharyngeal voice with one hand technique. Place your hand one side of the mouth, focus and relax throat, sound from the back of your throat, upper part of the pharynx. So this practice as a workshop, I want to tell all Puberphonia boys. Place the hand on the side of the cheek, just like a wall, and guide and bounce the sound inward. Speak ha 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 with relaxed jaw. Feel the vibration deep in the throat, behind the tongue, above the larynx, in the pharynx. Identify the sweet spot where you get a manly voice. Think the sound is rattling in the back of the throat, almost like controlling snoring. How great it is. So, by placing a hand at one side of the mouth, just like a wall, guide the sound, bounce the sound, and speak ha 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 with a relaxed jaw, open pharynx. Feel the vibration deep in your throat Feel the vibration deep in the throat, behind the tongue, above the larynx, in the upper pharynx, where the sweet spot is there. Third thing is shape the resonance. Imagine that you are snoring, snoring at the level of the uvula. Snore, hello, ha, ha. You can spot out the sweet spot in the uvula. Imagine your back of the throat snoring uvula, vowel shape that resonate in the pharynx. Little snoring, adjust during inhalation, hold that open, relaxed feeling in the pharynx. Speak vowel, ha, wa, in the same throat posture. Use exaggerated vowel shaping in the form of in front of the mirror with open mouth vertically, not with, and imagine the sound filling the throat instead of pushing outward. Practice like a drill. Sound is filling the throat. Hello. Instead of pushing outward, you can find out the sweet spot where you are getting a manly voice. Very easy. So these three procedures are over. The fourth one, placing your right hand on your stomach and raising above the head while chanting Om. You can better sense the movement and resonance of the pharynx while you are talking. So this is the abdominal breathing you have to do while doing a breath control. That is a breathing practice, you have to do it. The voice should come from the stomach with the movement of the diaphragm. That is only because of the hand movement. So there are four methods we have found out and telling you. Flex the neck forward, hum. Flex the neck. The pharyngeal cavity will automatically increase. Second thing is relax the jaw. Hand guided voice inward. Just like a wall, keep the hand in the side of the mouth and talk. Third thing is uvula, snore, speak, vowel in low, slow tones. So this will create a great idea that what you can do in the home training for puberphonia. The fourth one is place your right hand in the stomach and raise it above the head while chanting Om. So these are the four methods by which we can find out the sweet spot where you are getting the change in the high frequency, in low frequency, in the pharynx, upper pharynx, by the action of uvula and soft palate. Even olden days, even it is described about as open throat, but they have not mentioned about the sweet spot. But this practice doesn't stop in one day. In one day, you will get the voice. You will get the change in high frequency to low frequency by all this maneuver. When you are manipulating EULA along with software lead, we are able to send the sound to the nose and sound waves to the nose and oral cavity. But this should be practiced for 5 days. That is very important. But it needs to find out the sweet spot where the voice change from laryngeal sound to pharyngeal sound. That is from high frequency to low frequency. Then practice it. Just doing this practice, it will come in action if you are able to do the following 10 techniques. Number one is Xbox training. In Xbox, your image will be in the screen. You can talk by copying that. Second one is piano practice. Piano, there is a high frequency, low frequency, mid frequency. So your voice should match with that practice frequency. The third thing is it is a feedback. Fourth one is you are recording and hearing your voice. So that is the great thing in piano practice. Fifth, artificial intelligence. A doll can talk. Yes, the doll will practice. That we will be able to demonstrate in workshop. The doll will change the voice and practice. You can copy the same. Then audio visual practice with Kuroko. So repeatedly you should be interested and do it. Then practice with the treadmill. See, with other activity, if you are speaking, definitely you won't use the larynx too much. You will try to use the pharyngeal voice, then you will get the sweet spot of the voice where the high frequency is changed to low frequency. So that is with the practice with treadmill. Similarly, you can practice with vibrator. There are a lot of vibrators are available. So you can stand on the vibrator and do the practice. The last thing is in virtual field also with virtual audience, you can have a stage practice with mic and table. That will give a more encouragement for you. It is similar to group practice. So this will be a good, you will get a virtual audience. They will appreciate you. Nowadays, AI is there. You can talk to them and you can get the positive reply from them. That is the thing. Above all, that how to habituate it is anything is train. Habit make you habit. If continuously you train for 5 days. If you are training, staying in the hospital, you will bound to do it with the group therapy. Then the EULA moment automatically comes and you will resonate your voice and talk happily. So for that, we are trying to do an online Puberphonia treatment for 5 days for registered candidates. And they should be able to attend the online for 5 days continuously. That is very important. So that will come only by registration, and we have to find out the real motivation for the boys, for the puberphonia boys. They should become normal. So for that, we are creating a platform. It may be Zoom, Microsoft, Google Meet. So we are planning that. Then we'll schedule the date and time. We'll create a contact address and we'll promote the workshop. We'll definitely have question and answer session also. Above all, a great follow-up should be there. So with this, I want to clarify clearly, active EULA can influence voice frequency. That is a lesson I got today. There is fundamental frequency is there that is created by the vocal cord. And another frequency change by resonance is also there by the vocal tract. We are so happy today. We have finished 1,555 cases of Puberphonia. Today is Saturday, 12th April 2025. Happy every day. I am learning, I am sharing with you. I'll meet you next Saturday with new ideas. Thank you. Great, happy, happy, happy.